LE-style questions focused on decreased T cells and the associated infections. Candida, local, Pneumocystis jirovecii PCP, and Cryptococcus neoformans. Question 1. Candida, local mucocutaneous infection. A 36-year-old man with a history of HIV presents with painful white patches on his tongue and inner cheeks. The plaques can be scraped off, revealing erythematous mucosa. His CD4 plus T cell count is 150 millimicroquire. Which of the following pathogens is most likely responsible? A. Aspergillus fumigatus, B. Candida albicans, C. Cytomegalovirus, D. Cryptococcus neoformans, E. Epstein-Barr virus. Correct answer, B. Candida albicans. Explanation: oropharyngeal candida thrush is common in patients with decreased T cell immunity, especially in HIV when CD4 plus 200. Candida is a yeast that normally colonizes mucosa but causes disease in immunocompromised hosts. Why not the others? A. Aspergillus causes invasive lung disease, not thrush. C. CMV causes retinitis or colitis in AIDS. D. Cryptococcus causes meningitis, not oral plaques. E. EBV causes oral hairy leukoplakia, not scrapable. Question 2. Pneumocystis jirovecii pneumonia. A 32-year-old HIV-positive man presents with a 2-week history of progressive dyspnea, dry cough, and low-grade fever. Chest X-ray shows bilateral interstitial infiltrates. CD4 plus count is 75 mm². Which of the following is the most likely pathogen? A. Histoplasma capsulatum, B. Pneumocystis jirovecii, C. Mycobacterium tuberculosis, D. Streptococcus pneumonia, E. Cryptococcus neoformans. Correct answer, B. Pneumocystis jirovecii. Explanation: Pneumocystis jirovecii pneumonia, PCP, occurs in patients with CD4 plus 200 mm². It presents with non-productive cough, hypoxia, and diffuse bilateral infiltrates, diagnosed via silver stain or PCR of bowel fluid. Why not the others? A. Histoplasma causes more chronic infection associated with bird droppings. C. TB, cavitary lesions, productive cough. D. Strep pneumo causes lobar pneumonia, not diffuse infiltrates. E. Cryptococcus, CNS infection, not pneumonia in this presentation. Question 3. Cryptococcus meningitis. A 40-year-old man with untreated HIV presents with headache, fever, and photophobia. CSF analysis reveals elevated opening pressure, low glucose, and lymphocytic pleocytosis. India ink staining of CSF shows encapsulated yeast. What is the most likely causative organism? A. Candida albicans, B. Histoplasma capsulatum, C. Cryptococcus neoformans, D. Listeria monocytogenes, E. Toxoplasma gondii. Correct answer, C. Cryptococcus neoformans. Explanation: cryptococcal meningitis is a common opportunistic infection in T-cell deficient patients, e.g. AIDS with CD4 plus 100. The encapsulated yeast seen with India ink and positive cryptococcal antigen in CSF confirms diagnosis. Why not the others? A. Candida, rare cause of meningitis. B. Histoplasma can cause meningitis, but not encapsulated yeast. Listeria bacteria, not yeast, seen in neonates, elderly. E. Toxoplasma causes brain abscesses, not meningitis. Would you like a chart?